My name is Veda Fountain, and this is going to be my Enema checkoff. So to start, I got clean gloves and goggles on. I've got my lube right here. I've got my pure Castile soap right here. I've got my Enema bag and my Enema tubing, and then I also have this drape. Okay, this is going to be the video that I show filling my Enema bag. So what you're going to want to do initially is go ahead and clamp the tubing. Once it's clamped, you're going to want to fill the Enema bag 750 milliliters to 1,000 milliliters of warm water. Okay, and then whenever you get that much, you're gonna wanna go ahead and add the soap to it. Okay, and then once you're done with the soap, you're gonna want to go ahead and gently agitate the bag. And then after this, you're going to want to go ahead and prime the tubing. So what you're gonna do is unclamp it. And then once you're done with that, you're gonna wanna reclamp it now that the tubing is primed. And then you want to go ahead and place this either on an IV pole or on a sturdy table, but you do not wanna place it on the patient's bed. So this is the video for the Enema insertion. So initially I'm going to place my patient on their left side in the left lateral Sims position. And then after this, I'm going to go ahead and instruct the patient on the procedure that's about to happen. I'm going to tell them that what they can do is go ahead and take a few deep breaths whenever the tubing is going in, and if they have hemorrhoids, I can tell them to bear down to help facilitate the process. So once they're done with that, I would go ahead and take off this blue cap, and since this is already pre-lubricated, I don't have to lubricate it. But if I was going to lubricate it more, or if it wasn't lubricated, I'll go ahead and squeeze it onto the tubing and also onto the clear wrapper and wrap it around to make sure that it was fully lubricated. So once I'm done with this, I'm going to place my non-dominant hand on the patient's hip, push a little bit, and then I'm going to insert the tubing about 3 to 4 inches. I'm going to hold the tubing in place. I'm going to go ahead and unclamp the tubing. And then once I'm done with that, I'm going to raise the bag about 12 to 18 inches above them. And if they experience any kind of discomfort, I can lower the bag a little bit and tell them to take deep breaths.